We want to talk about tropical diseases, neglected tropical diseases. And we have a guest with us in the studio. His name is Michael Ofire. Ofire, he's the programs manager, AMREF Health of Africa. Karibu sana, Michael. Welcome to the hot seat of the Situation Room. How are you doing?
I'm doing well. Yourself?
Very well. Courtesy of EcoBank City, the day's African proverb.
Yes, from the Kingdom of Morocco. Mm-hmm. Okay. Now, maybe you didn't know this, but the sort of government Morocco has a very unique one. Okay, it's called a unitary parliamentary semi-constitutional monarchy. Mm. So, when Kenyans talk about what system we mean, forget this Westminster, you have a hybrid that works for you. Mm. If you want 3 deputy prime ministers, have them. If you want a president and a co-president and then a deputy president, have it. Whatever it is you think, whatever works for you, go for what works for you. Right. The proverb. There is no queue at the gate of patience.
There is no queue at the gate of patience. Michael, when you hear this proverb, what do you think the Moroccans are saying?
I think the Moroccans are generally telling you that, your patience should never win out.
Mm-hmm.
Yeah. So definitely just keep your eye on the goal. Yeah, no matter how long it takes. Yeah, you'll just get to, the intended goal.
Okay. Yeah. Now, the World Neglected Tropical Diseases Day is coming up. When is it and why is it important?
Yeah, so this is the 3rd celebration that you're having on the 30th of January this year. And this is after it was officially recognized by the World Health Assembly in 2021. That is May, the 74th World Health Assembly. So, of course, all countries, including Kenya, our first celebration was 30th of January of 2022, where we did our celebrations here in Nairobi at the KICC. Last year, we commemorated the World Entity Day, same day, 30th of January in Kisumu. And 30th of January on Tuesday, we'll be meeting in Ombaso for the World Entity Day 2024. The reason why this day is important, one, is to galvanize communities that are at risk or affected with these diseases. And of course, to try and educate masses, these diseases are preventable, and, how can you prevent yourself? And if you're afflicted or you're affected already, what treatment options do you have, And that's all. And of course, targeting the policymakers, not only just at the, in-country, but of course, global scene, so that we can figure out how we can galvanize everybody, the whole of society, to prioritize and, help tackle these diseases.
What are tropical diseases and why are they called tropical?
So tropical diseases are diseases that are found within the tropical regions of the world. But my specific focus is on neglected tropical diseases. So tropical diseases are quite many, including malaria that we are aware of here. But my focus will be today is on neglected tropical diseases. So for those who studied geography, back in high school, we know of the Tropic of Cancer and Capricorn. So any country or other regions of the world that fall in between the Tropic of Cancer and Capricorn, those regions are considered tropical regions of the world. So these diseases are largely found within those regions. But of course, in light of the recent climatic changes, of course, some of the cases are beginning to be reported outside the tropical regions. So it's something that, the world needs to be aware and, potentially it's the next pandemic. If we do nothing now, then definitely the whole world is at risk.
Which are these neglected ones? And who's neglected them and why?
So WHO, that is the World Health Organization, formally recognized 20 diseases, and late last year, the 21st disease was added. It's called Noma. From, in Kenya, we know a slang name, Noma.
Yeah.
So actually still the same, that's how it's written.
Ugonjwa ni Noma.
Ni Noma kabisa, yeah. So the people that are neglecting them, of course, I would just say the whole of society, because one, we have the community members that are suffering. At times, we don't say that, they have all the necessary knowledge and equipment to address, or prevent themselves from these diseases. So it comes back to the policy makers, the resource allocators, the global players. Because we understand governments all over the world can never work alone. And so there's the role of the private sector, the donor community. So these diseases receive minimal attention, yeah? And so, the more we continue neglecting them, from the word neglect, then it means millions and billions of people. In fact, according to statistics from the World Health Organization, approximately 1.5 billion people in the world are at risk of one or more neglected tropical diseases. If we come to Kenya, I think currently our population is approaching 60 million. Even those of us that are seated in this interview, we are at risk of at least one neglected tropical disease. Yeah.
Do you mind? Sorry.
No, please do.
So just do you mind just going specifically as to why they are called neglected? Because we still, if you get sick today with one of these diseases, you go to hospital to be treated, right? But why are they called neglected?
Yeah, so as I was trying to explain, of course, the neglect is, across the whole spectrum in the community. Of course, in the medical field, even in the training curriculum, most of these diseases are just mentioned passively, Even the treatment, the diagnosis, the management in itself, is a gap, not only in Kenya, but of course all over the world, yeah? So that is why they're neglected. And so when they're receiving minimal attention, it means even the resource allocation, in tackling these diseases, is something that is wanting. And of course, these conditions, we have some that are, are highly fatal. For instance, snake bites, If I'm bitten by a venomous snake, that becomes a health emergency. But if you go to most of our facilities in the country, we don't even stock the anti-snake venoms,
Yeah.
So, we continue losing people, yeah? We have a disease that's called Kala-Azar leishmaniasis. It's 95% fatal of all the cases that, have the visceral,
95%
fatal, yeah?
Definitely.
So if you fail to treat, then definitely it means there are people you're losing. And anyway, most of these diseases, they're chronic in nature. They take long to manifest, So the impact is what is being felt in the communities. They might probably not kill you today or in a year or two, but the lifelong, they lead to disability. We have elephantiasis, is one of these neglected tropical diseases. It's not a disease that, I'll get infected today and then in a year or two, I'm already having the manifestations,
How long does it take?
It will take even up to 15 years,
Okay.
And now when you have the clinical manifestations, the impacts are devastating. Yeah.
What I find interesting is that for a disease to be referred to as neglected, which means we know it exists. So who neglects it, and how does a disease get to become neglected? It's like a qualification. You were once a disease that we paid attention to, because if we didn't pay attention to you, then you wouldn't be neglected. That is how we've always been. But if we're saying neglect, it means there was a time we paid attention to it. There's a time we consider it to be a priority. Why did it lose that priority?
And if I may just tag on to that, especially with some of these diseases that have such devastating effects. We've talked about, leishmaniasis here with a 95% possibility of fatality. Why would you neglect? Why would anybody who neglects? Sorry.
Yeah, the way the society is structured, yeah, and it's something that I think I don't know, we might want to blame our predecessors, but I think we all equally carry the blame. So most of these diseases, unfortunately, affect the poor in the society, yeah? So they are the highest at risk, And our policymakers the poorest in the society? Your answer is as good as mine, yeah? So, we, the people that, have the financial capability, they focus on the disease, or rather they prioritize diseases that, they think they're at risk of those diseases, And so, it's something that, the society needs just to see how we can figure out. And there is a good question that, we probably think that at some point, they were being given attention, and then later on they were neglected. The answer is yes and no. One is because the good news is that we have people globally that, are giving attention to these diseases. Currently, we are working within the 2030 WHO NTD roadmap, yeah? And the theme of that roadmap is end the neglect, So it's trying to rally the whole world to end the neglect. And that doesn't mean organizations like ours, AMREF South Africa, and of course other stakeholders, including, from the Ministry of Health and the county government. It doesn't mean that, nothing has been happening. So a lot has been happening already, but then we need to elevate it so that, everybody else knows that I am actually at risk of these diseases. Yeah.
But then, you see, there's an entire value chain here. We are talking about from academia, research into the pharma industry, coming up with treatment and medicine, into policy, into allocation of budgets, into the community itself and how the community treats it. So when we say neglected, it seems that everybody else has basically just said it's not really neglected, just not giving as much attention as you're giving malaria. Is that what we're saying?
Correctly.
Because it means that if you had Kala-Azar today and you went to hospital, there's a doctor who will know that this is Kala-Azar.
You'll be treated.
Will they be able to tell that this is Kala-Azar that you have?
My answer is yes and no.
Okay.
And the reason, of course, as I had earlier alluded, is, the neglect even starts from the training institutions.
Okay.
Yeah. So I think there is a need to, try and revise the training curriculum, yeah? Because, various diseases present differently. And at times, we have this thing we call differential diagnosis. For instance, I have a fever. Fever is a symptom of malaria. But then I could be suffering from another neglected tropical disease called dengue fever. So there's a challenge when it comes to differential diagnosis. And, if these things are not captured in the training curriculum, not just in the medical fraternity, we have the laboratory personnel, etc., and the rest of the healthcare, cadres and pharmacists. So if these things are not addressed back then, the other thing is when you're talking about the pharmaceutical industries, for instance, a lot of effort has been made from various pharma companies globally because as a country, we usually receive donated medicines through WHO, yeah? And, someone is meeting this cost in as much as they come to the country free of charge, but someone is meeting this cost, I know it's been in Kenya's plan to probably try and, do local manufacturing and production of medicine. I think that has been part of the agenda of the current government and, of course, also from the former government as well. So I think, if we can already begin, for instance, just, producing in country some of the medications that we require to address some of these conditions, I think that will be an initial step in the right direction, And of course, training of the various medical personnel. So we've been doing that already, trying just to capacity build and orient the various health workers on the treatment and management of these conditions. So a lot of effort has been going on, but not unless you've interacted with these conditions, then it becomes difficult for you to have the expertise in managing.
So can we say that one of the contributing factors to this neglect is prevalence? If you don't have many cases of a particular disease occurring in country, in a region, in a specific area, then there'll be no much attention given to it.
Prevalence is a poor marker if we want to focus on diseases in terms of the prevalence. So it means we want more people to be sick so that we can give attention to those diseases. I think what we need to focus on is how to prevent more people from, being infected,
Yes.
For instance, if you look at malaria, there's a lot of that has happened, in country when it comes to malaria, including the mass net distribution. So what are we focusing on? Preventing more people from being sick.
Because we have seen many people falling sick and we have seen many people dying, and it becomes a concern. It becomes a concern at community level. it becomes a concern at health system level, right? So then
Correct.
attention is given. Now, if you don't have many people, for example, in a village with elephantiasis, then the community does not raise concern. No, okay, so that one has elephantiasis, it's an issue, but it doesn't become a concern. So then that concern is not escalated upwards.
Yeah, I think as I had highly indicated, most of the policymakers are not the poorest in the community, yeah? And if we look at the most afflicted with these diseases are actually the poor, and it continues to contribute to the vicious cycle of poverty, So I wouldn't say that prevalence is a good marker for it, but let us look at the impact these diseases cause.
Okay.
Yeah? If you're talking about, for instance, I just talked about leishmaniasis calaza, fatality rate is 95%. What is the fatality rate of malaria, Why are we giving more attention to malaria and, and continue neglecting some of these diseases? If we look at, for instance, elephantiasis, the disease is still spread by the same mosquito that spreads malaria, And we want to appreciate the efforts that have gone towards, mass net distribution, because if you look at elephantiasis, for instance, that is endemic within the coastal region of the country, it has largely contributed to the reduction of incidences, over the years, because there has been a robust program on mass net distribution. But apart from that, we've also been doing, preventive treatment that we give to the community members. Remember, I indicated that we are at risk of one or more, all of us in the country, yeah? And this medication in itself, we've provided over the years. And of course, I want to acknowledge, external, parties like the End Fund that has been actively supporting some of our interventions in country. And when it comes to the coastal region, for instance, we had 23 sub-counties, that were known to, to have a high risk of lymphatic filariasis. But as we speak, now we have reduced that to around 5, There is a surveying ongoing in Mombasa, in 5 sub-counties in Mombasa as we speak. And by Friday, we'll be knowing, okay, have we kicked out lymphatic filariasis in the country, So a lot has been done. And if we want to look at more cases to come up so that we can say we actually need to give attention to this, I'll tell you we'll wait longer, because we've already done quite a lot in terms of preventing more people from getting these diseases. However, we have a few people that are already afflicted,
Yeah.
They have some of these clinical manifestations. So when it comes to lymphatic filariasis, that is elephantiasis, it manifests twice. I know commonly people know the presentation, when you have your lower limbs, the extremities, having the swellings, the legs, etc. But we have men that have swellings in the scrotal region. So we've been doing a lot of surgeries just to try and, rehabilitate them. And I think the gap that we have is how to integrate them back into the community, So that is the role of the media, because at times, how do we educate communities?
Maybe one thing is to, just is to understand, let's look at Kenya, because neglected tropical diseases are in different parts of the world, isn't it? But looking at Kenya then to understand what some of those actually are and how they are transmitted, what are we looking at here?
Yeah, so in Kenya, out of the 21 diseases, at least 17 have been reported into the country. I will not list all of them. I'll just focus on the ones that have been receiving immediate attention. But of course, what you're trying to champion is to end the neglect of the rest that, are currently not being prioritized, So we're talking about intestinal worms. Minyo. I would ask you, when was the last time you dewormed? It's a neglected tropical diseases. I don't know, when was the last time?
Minyo is a neglected disease.
Yes.
Well, to deworm implies that I have worms. I don't have worms.
When was the last time you tested?
I don't know.
How do you know?
I actually haven't. But we're going on to the hour.
Yeah,
but it segues into something that I want to ask, and thank you for asking that question.
So, one of them is those intestinal worms.
Yeah.
Another
and
one.
I can tell you for a fact, after this interview, go and test your stool samples. You'll find that you have worms. So remember when you're talking about the neglect?
No, all of us.
Always.
No, not specifically you.
I was looking at me. I actually dewormed in November.
In
last
November?
Year.
Yeah, I
Yes.
think for her, she tried in yourself.
Mimi hiyo mwaka imepita.
Yeah.
I'm okay.
Wewe unasema mwaka. Me, I've never dewormed in my life.
Oh. So what else apart from intestinal worms are we looking at?
Yeah, so we have elephantiasis that I was just talking about.
Yeah.
We have Kalaza, the leishmaniasis that I just talked about. We have the snake bites. Dengue. We have chikungunya.
Chikungunya.
Yes.
What is that? Okay, we can come back to that.
Yeah, and we have trachoma. Yeah, I think we are all aware of trachoma, the blinding trachoma.
Yes.
How many are those?
Those are 1, 2, 3, 4, 5, 6, 7.
Yeah, so we have others called mycetoma, we have scabies, we have jiggers.
Scabies new pele.
Yes. We have jiggers. It's a neglected tropical disease. You know?
Jiggers is a disease.
Yes. We have
Schistosomiasis.
bilharzia, that's called schistosomiasis.
Yeah.
Yeah, and I mean, we have a lot of investments that we are also helping the country. As AMREF, we have a program in 4 western counties. That is Vihiga, Bungoma, Trans Nzoia, and the other one.
Big.
Vihiga, Trans Nzoia.
Which one?
Boma.
Busia.
No, Busia.
Kakamega.
Kakamega, yeah.
No, in the
that's
Westerns, you have to
Is
go through the list.
schistosomiasis caused by the bite of the tsetse fly?
No.
What's that one?
So the one that's caused, thank you for reminding me, that's sleeping sickness.
Yeah.
Yeah.
Trypanosomiasis.
Yeah.
Right.
I think, human African type trypanosomiasis.
Okay.
Yes.
What was the other name you called, Kalaza?
Leishmaniasis.
There you go. Hey. Elephantiasis.
Lymphatic filariasis.
Yeah. Dengue fever is dengue fever.
Yeah, dengue fever is dengue.
Chikungunya is chikungunya.
Chikungunya, correct.
Bilharzia is bilharzia.
Schistosomiasis
There you go. Scabies.
is scabies.
Jiggers.
Tungiasis.
So anything with this isis, you see a swelling of something, right?
Not necessarily.
Something. So what is this? What is this cis? I'm just asking that question because it seems that
Sis.
with these
Tells
ones
you it's
you
neglected.
see- So then I guess on that question then, Michael, is that just because they're called neglected, when you hear neglected as an individual, you assume that it's not that important,
Yeah.
isn't it? And could that now lead to why they have been neglected? Because of maybe the number of people who are infected or affected by them? And if they are as important as you say they are, clearly, because of some of the things that we see, the symptoms, the impact on communities, impact on individuals, why should people bother if they've been neglected and they've been pushed back into some corner somewhere?
Michael is being polite. He alluded to people in the low economic strata of the economy bearing the brunt of these diseases.
Yeah.
Now, it is a sad and very unfortunate reality, but people in that bracket tend to be neglected. So let's forget the disease, people.
The population.
That cadre of individuals, say even in a country like Kenya, we are likely to be neglected. They bear the brunt of everything. And it follows that if there are diseases that you find, they will also bear the brunt of those diseases.
So are the diseases neglected more so because the people who are affected by them as societies and communities in terms of social issues generally are more neglected?
Did you not ask the question, who are policymakers? Are they poor? Are they people who are likely to have a challenge when it comes to healthcare seeking or be able to afford it?
So?
Yeah, I think the word neglect needs to evoke emotions. You know, if I tell you you're neglected, it actually needs to evoke emotions and realize, by the way, there's something that I need to do. You know, So I think it's a careful word that was selected so that, I mean, we can see whether it can evoke emotions and, the policy makers, the people that, are driving the global health agenda can realize, oh, by the way, there are these conditions that, in as much as we want to call them, imagine calling each disease by its name. There are already 21 diseases, among the other commonly known diseases, So they needed to find a house. Where would they fit in? Under the term neglect. So that now it can evoke emotions.
Coronavirus scared the living daylight out of literally everybody on this planet.
Yeah.
It did not discriminate who it attacked or killed.
Correct.
It caught the attention of the world. When you look at non-communicable diseases, let's look at cancer. Let's look at why cancer is such a big issue. Every time someone who is a known public figure and holds a position of importance, if they have that disease, everybody gets to know about the disease because it will be spoken of.
Yeah.
Unfortunately, everything that you're mentioning, most of these diseases, one doesn't hear of them among people who have the means and people who are in positions of authority. My question: of these diseases, which ones are not preventable?
My best answer is none.
Precisely. I've heard you speak, and I was waiting for you to talk about the preventative work that you're doing. You mentioned it in a sentence. If they are preventable, it means that even a poor, struggling, bedeviled government like this one of ours can at least do something about it. Because you start with, if people know about it, and then the preventative aspects are brought in, you'll know what you're dealing with. How much effort is actually made to ensure that these diseases, you talk about nets, it's mosquitoes. How much effort is actually made to ensure that people are aware? You'll tell us, the media, we're talking about it, but how much concerted, deliberate effort is made that people know about it, the areas where it's prevalent, and what is being done? Because if that is done, if they're prevented, then the issue of setting up this and setting up that and providing drugs for this will be reduced immensely, because that is a cost factor. The moment you bring in medication, the moment you bring in treatment, you're talking about cost. And that automatically will hive off a huge population because they can't afford it. And yet, they can afford to prevent it.
All right, let me just pick up from where you left. And I think we all know that prevention is better than cure.
Do we really?
Yes. And prevention is cheaper.
Do we really?
Cure. So, I want to appreciate the national government in Kenya. They've done quite a lot in terms of, championing and addressing the burden of neglected tropical diseases. Case in point, the ministry in itself, I don't work for the government, but I think we need to, laud the government where, it has, made deliberate efforts. If you're having officers with a dedicated section head to give priority and focus on these diseases, I think that in itself is a step in the right direction.
Yeah.
Because these officers have not been allocated other duties apart from focusing on addressing the 17 neglected tropical diseases in the country. I think we need to, and then the other thing is, we give treatment in the communities, and of course that is the government working hand in hand with the non-governmental organizations like ourselves, AMREF of Africa. We know the government can never work alone in everything, because they are limited. That will mean they spread themselves too thin. So that is the role of non-state actors. How do you complement government efforts? I indicated we've been giving preventive treatment. And when I'm talking about medication, not all medication is curative.
Okay.
Some are meant to prevent. For instance...
You're talking about the prophylaxis.
Yes, the prophylaxis.
Yes.
Correct. So some are meant to prevent you from, acquiring a certain condition,
Yes.
And if the condition is still in its infancy stage, the medication will actually kill the pathogens, or the parasites, it will actually kill. And because, one, I have 500 Kenya shillings, I will treat you for elephantiasis. But if I leave you alone, the cost of surgery is 40,000 Kenya shillings.
Yeah.
So which one is cheaper, giving you medication as preventing or waiting for you in the theater?
So what's been done now? Because we're talking about the master plan, Kenya's master plan for this, and you're saying the ministry has dedicated even desks to deal with these neglected tropical diseases. Now, is it an issue of mapping out the areas where you're likely to find chikungunya, dengue, and this and the other, and then coming up with those programs that we talk about preventive measures, community awareness? Is that happening?
Correct. A lot has already gone into that in terms of, mapping. And of course, beyond the support that the government is giving, by the fact that you have a policy document in the country, you know, that already shows government commitment,
Okay.
You're talking about a master plan 2027, 2023, 2027. That's a roadmap that the country has undertaken and indicating like, okay, by 2027, there are some diseases that we have earmarked to kick out of the country, And, if for you to kick that out, it means that you have to understand the burden. How do you do the burden? You have to do like the baseline and mapping surveys. A lot has been done when it comes to mapping and and understanding, which counties, are endemic of which diseases, But the reality is not all diseases have been mapped.
Gotcha.
Remember, we are talking about 17 diseases that have at least been reported in the country, and 21 diseases listed by the World Health Organization, So you realize this is resource intensive, in economies like ours, Let us look at COVID-19. Even countries that have the most developed healthcare systems, did they break down? Definitely, yes,
Yep.
So, in as much as we want to, we're putting our government to task to help us, strengthen the health system. I think all countries learned from the COVID-19 pandemic, and I think there are already deliberate efforts, both in the country, and I think recently last year you heard of the primary care network that was launched by the Cabinet Secretary for Health. And all these things are trying to see like how can we pick early cases in the community, for instance, so that we prevent community members from disease progression, because when these conditions progress, some are irreversible, some are not treatable, some will lead to fatality.
I want to ask a rhetorical question. But before I ask the question, let me agree with you that if you know how the Ministry of Health works, you'll be amazed at what they actually do. You'll be amazed at the time and the expertise that is actually dedicated to diseases around this country. It's truly fascinating. But my question now begins with the but. Of all these initiatives, how many of them, 3 categories, are fully donor funded, assisted, fully Government of Kenya funded? It's a rhetorical question. I'm asking the question because I'm going somewhere. I don't want a response to it. I'm simply saying, in the absence of support from donor funds or donor funds pushing that particular agenda, would we be able to manage these diseases?
I wouldn't want to say that it's donor support pushing this or the non-state actors, But there is nothing wrong with that because their role is to elevate community voices, One, by the fact that a government is owning and launching a policy document, that already shows that the government is at the center of it. So our role is just to come in and support government efforts. We never come up with any programs that we think will work for the country.
Okay. Let me give you an example of a policy that I know of, adopted by the WHO, and the process by which it was arrived at. Let's say the policy of, test and treat in HIV. Any policy that is owned by the national government, the Ministry of Health, WHO, has to be evidence-based, meaning research has to be conducted. Literally all medical research projects in this country are donor-funded. I'm saying all, literally. If there are some which are not, you can point them out to me. I'm not saying there's anything wrong with it. I'm simply saying they are donor-funded. Funded, literally. Now, if our dependency is on that funding, talk about PEPFAR, 20 years, $8 billion spent over that period of time. We've moved the needle. But have we moved the needle of self-reliance where we ourselves are getting, because it's our people who do this work. It's our expertise. We have the expertise. Have we moved the needle? And I'm still stuck on this preventative aspects of it because this is something that can be done.
Yeah, allow me to give a broad response to that. Of course, we work like on a day-to-day basis with the National Ministry of Health, which is the government of Kenya. And I mean, at times we tend to be very biased on how we look at things from the, outward look.
Yeah.
We look at the cost of delivering interventions, but at times we never look at what it entails, for instance, to pay a government officer a salary, assuming we didn't have dedicated officers that are paying by, we all pay taxes, so they're paying by taxpayers' money. Assuming we didn't have them, then it would be the role of non-state actors to try and push this agenda. But by the fact that we have officers dedicated, not just within the national government, even when you go down to the various county governments, there is significant contributions that they're asking. But I think the question you're trying to pose is about sustainability, And I mean, we understand that, sustainability, there is no one, mechanism to achieve sustainability. Earlier on you were talking about Kiwi, for instance. These are private entities. They do corporate social responsibility. So we would ask, like, private companies, for instance, that are doing business in Kenya and getting profits in the country. We have initiatives. We come talk to us, At times, maybe they don't want to go directly to the government, but we are non-state actors. Come, let us collaborate. And I think this is a rallying call to Kiwi, as we are trying to, because I'm, I use Kiwi to polish my shoes, So I'm a customer of Kiwi, But what if I buy these products, but I know part of the profit they're getting, it's coming to complement, some of the activities or, the efforts that, we are making. We all understand the setting we are in the country. Think, the government has been talking about, the debt burden that we have in the country. I think we might be overambitious, expecting the government is in a position to meet all the costs, Even when you go to the developed nations, I mean, we receive donation largely from, we have companies in the country that actually give donations to, some of the programs that we do. So I'm not going to give, mention specific companies. But again, even in the developed nations, when you go to those countries, you still have non-state actors,
Many.
Yeah, and they're still complementing what their governments are doing.
Okay.
Yeah, so I think we wouldn't want to, push all the blame to the Kenyan government, because we realize there is the much they can do, but again, it's our role as non-state actors and as citizens just to see how we are able to complement those efforts.
Michael, you defined the neglected tropical disease, and you said the society appears to have neglected. Government appears to have neglected these diseases by how much attention they are giving these diseases. And then at the same time, we're talking about Kenya's master plan. So you say there's a policy, there's a master plan that looks at 2023, 2027.
Yeah, correct.
There is that means that there are programs that have been designed for these. There are interventions that have been designed. There's collaboration. Actors such as yourselves, AMREF, Health Africa, and others have been brought on board. Budgets have been drawn. Programs are happening on the ground, supported by government. That doesn't sound neglected to me.
I think a lot has happened, If you're talking about the 2023-2027, NTD master plan for the country, it means that you're transitioning from something. So the first master plan for the country was 2016-2020, And in between, the government came up with another strategic document that was called the Breaking Transmission Strategy that was from 2018 to 2023. So there has never really been a vacuum. So I think there was what the country was able to achieve by 2020. By 2023, last year, there are some of the targets that the country had set and they were able to achieve. So now the 2023-2027 is trying to build onto the previous successes, And for instance, elephantiasis, we are eliminating it, Come 30th of January, I hope we'll be meeting in Mombasa. I think the government will be giving very positive communication regarding this,
Right.
There are other diseases that before 2027, of course, the government of Kenya has prioritized because you can't, you must have a strategic direction. You can't target everything, even including in your house. I don't think, you are ambitious, you have several goals that you want to achieve, but you have to set, realizable targets, So there are diseases that in the country have been earmarked for elimination by 2027. I think by being a key stakeholders in the fraternity of the NTD, I'm not holding any brief for the government, but of course a lot of efforts have been made and we're going to achieve.
And closer to us.
So I think there will be very positive communications that will be coming from the government in the near future.
So are we likely to ever get to a point where then we remove the word neglected from them? This is not a neglected tropical disease. If you look at the work that we've done over the last 20 years, we've focused our attention into it. So as far as we are concerned in this country, for example, elephantiasis is not a neglected tropical disease. It's a tropical disease that the government is putting attention on, that other stakeholders, including the community, are putting attention on. It's not neglected.
I think this is a conversation that, Kenya cannot hold in itself. But I think it's something that can be championed through the World Health Assembly, And I think, once attention has been given globally, like adequate attention until, it gets to a point whereby, people recognize that the term neglect doesn't fit the purpose anymore. I think, that conversation will be held then. But I think, as earlier we indicated that it's not the diseases that are actually neglected. It's actually the people.
Sure.
Because the diseases can't be in absentia of the people. Yeah.
I guess the last one on this then is that in countries where we've seen other diseases eliminated, we talk about polio and measles and things like that, there was robust immunization. Is this one of the factors towards elimination as well? If there is preventative aspects that can be taken towards them, do we see things like that happening? Or I guess the broader question would be, what are some of the factors for elimination of these diseases?
All right. So one, Kenya has already eliminated one neglected tropical diseases that's called guinea worm disease. I think we are all aware of guinea worm. You can remember there's a point that they're saying if you get one case, you'll receive a prize of 100,000 Kenya shilling. So we hardly receive any cases in country because there is heightened surveillance, So a lot, something has already happened, and that was back in 2017, Other 3 or 4 will be eliminated, in the near future, and I think the government will be talking about it, I think I missed the second part of your question.
So I'm just asking, what now are the factors that would be used towards elimination? Yeah.
Okay. The diseases that indicated, there are 17 in the country and 21, but there are various elimination thresholds,
Okay.
So there is no one response that, would encompass all the diseases,
Okay. Michael Ofire, Programs Manager, AMREF Health Africa, thank you very much for joining us. And as we mark the World Neglected Tropical Diseases Day on the 30th of February, where will we be? In Mombasa?
Yeah, we'll be meeting in Mombasa, the Tononoka grounds. Yeah, and we'll be having, of course, the high government leadership, of course, convening in Mombasa. So we'll just like to welcome the community members residing in Mombasa and, in the country at large. We'll be having the commemoration in various counties. in the western counties. Yeah, thank you.
This is the Situation Room, the only way to start your day.